Hi, my name is Pat Morgan, and I'm going to share some stories with you about two of my healthcare experiences. My first story begins early in 2003. At that time, I sought treatment for a loud noise, kind of like a washing machine noise in my left ear. After two visits with doctors, one was with an ENT, and several rounds of antibiotics, my condition worsened. I also began to experience severe pain in my right eye. I met again with the ENT, and he prescribed blood tests, a CAT scan, and referred me to my ophthalmologist for the eye pain. My eye doctor slightly tweaked my prescription for glasses, and the ENT scheduled me for surgery. He inserted tubes in my left ear and drained liquid out of the ear. Neither the surgery nor the changed eyeglass prescription provided any relief. In the following weeks, I had additional appointments with multiple doctors, but nobody could agree on a diagnosis. One said that I had a tumor on my pituitary gland, another said I had sarcoidosis, and several said that I had cancer. By the end of June, the eye pain was so severe that I was rushed to the ER and had emergency surgery. But unfortunately, it was too late, because the real cause of the problem, a fistula in my cavernous sinus, had crushed my optic nerve, and I lost sight in my left eye. It's sad, but it's also maddening. The doctors in the ER told me that I was correctly articulating the symptoms of a fistula, and that all my doctors had to do was place the stethoscope on the side of my neck, and they would have known that I had a fistula. But none of my doctors performed that very simple test. That's the end of story one. I will tell you that during the 4 months that I was treated for that unknown ailment, I developed a healthy fear of doctors. My second story begins in 2009, and it also involved a misdiagnosis along with the provision of poor care. On a regular routine visit to the ENT in January, he told me that I had an ear infection. He prescribed ear drops and told me to return in 3 weeks. I was scheduled for vacation, so he referred me to a doctor in the city where I was going to reside. In February, I saw the new ENT. He diagnosed a cyst in the inner ear that had to be surgically removed. Needless to say, I was very surprised by this diagnosis. Since I didn't know that doctor, I opted to return home for the surgery. In retrospect, that was probably a mistake. In May, I had surgery to remove the cyst, and I was scheduled for an early morning procedure. Actually, I wasn't taken to the OR room until around 1 o'clock in the afternoon, and only at that time was I told the reason for the delay. Apparently, the doctor had unexpected conditions with the previous patient. Rather unsettling news prior to surgery. But more unsettling was actually my release from the hospital later that afternoon. I never saw the surgeon, so I didn't know the results of the surgery. But more serious, I was not given a prescription for antibiotics. I'm not going to bore you with all the details of what I went through in order to get the prescription and to secure a time when I could have the stitches removed. So it's not surprising that in less than 2 weeks, I again had an infection in my ear. I saw the surgeon twice after that, but frankly, I lost confidence in that doctor. And in September, with the advice of my internist, I saw another ENT. After examinations and tests, he said that there was severe damage to my inner ear as a result of the infection, and I was scheduled for a more serious surgery than the one I had in May. End of my second story. The question is, do I think healthcare or the implementation of healthcare reform would have changed the care that I received? And the answer is a resounding yes, for several reasons. First of all, with healthcare reform, I would have been in a medical home and someone would have been directing my care. Secondly, all my doctors, even those that didn't do me any good, they were all paid. That's not going to happen with healthcare reform. And if you look at the cost to the healthcare system that resulted from the care that I received in the two examples that I gave you, it's ridiculous. There were so many unnecessary procedures, so many procedures that were duplicated. It was a total waste. So I could go on, but I know you get the picture. So I will just say thank you for listening to my stories.